evening and thanks for joining us. I'm Woody Ryan.
And I'm Jamison Euler. Brendan has the night off. We begin tonight with tracking Ebola. The CDC just wrapping up a conference call with Florida hospitals, sharing the very latest information on how to best prepare for the Ebola virus. Our Adam Weiner is following that story new at 6, and he joins us now in the studio with more. Adam?
Good evening. The biggest questions from Florida health officials: how to keep healthcare workers safe and how to make sure no hospitals in Florida make the same kinds of mistakes made at one hospital in Texas.
The CDC should tell us how Ebola was treated differently in Atlanta as compared to Dallas.
That was Governor Rick Scott Friday, calling out the CDC for not doing enough. In response, the CDC held an Ebola preparedness conference called just for hospital leaders in Florida.
Our guidelines, as used in Texas, do not work.
So today, hospital officials in Florida had a chance to ask about the latest CDC guidelines, including the best use of protective equipment, medical waste, and how to handle potentially infected patients.
Is there any recommendation on how we transport them and what they need to wear to protect themselves?
Any further guidance in employee vacation travel or isolating them on return?
Is there any guidance on if an employee does not want to or refuses to care for a suspected patient?
Listening, learning, and adapting. It's the most important thing we can do.
Dr. Jay Wolfson is a national health policy consultant and USF professor. He says hospitals are good at daily tragedies.
But what we're not very good at in our society in general is planning for the long term and for planning about things that are not confronting us right away.
So Dr. Wolfson sees these calls as a rare chance to prepare.
When you get right down to it, we don't know a lot about what we will know. We've never faced anything quite like this before.
Today's conference call just one of several requests from Governor Rick Scott to the CDC. His office says they're still waiting for more Ebola testing equipment and more protective gear. Back to you.